Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
You've taken a hit to the chest, maybe a fall, maybe a tackle, or even a heavy knock. It hurts to breathe, to move, to cough, and you're thinking, is it just a bruise, or is it something more serious, like a fractured rib? Well, let's explore it. A fractured rib is exactly what it sounds like, a crack or break in one or more of the ribs. It's a common injury, especially in sports, falls, and motor vehicle accidents. But here's the thing, rib fractures aren't just painful, they can be dangerous. Why? Because your ribs protect vital organs such as your lung, heart, and major blood vessels. So a broken rib isn't just about the bone, it's about what's underneath as well. So how does it present? Sharp, localized chest pain. Pain worsening on breathing, coughing, or movement. Tenderness over the rib area. And the patient will be shallow breathing because deep breaths hurt. Sometimes the patient might even hear or feel a crack at the time of injury. Now, some red flags to look for. Difficulty breathing, rapid or worsening pain, coughing up blood. These could indicate complications like a punctured lung, and that's life-threatening. So what do? First of all, DRS ABCD primary assessment. Then help them into the most comfortable position. This is usually sitting upright, leaning slightly to the injured side. Encourage gentle, normal breathing, even though it hurts. Maybe some ice can go to the area. It might help reduce pain and swelling. Now, it's important we don't apply any bandages or wrap the chest. Let the chest move naturally. Support the injured side if needed. Sometimes the patient will hold it themselves. And perhaps seek medical assessment. Now, fractured ribs is not a life-threatening emergency, and an ambulance is probably not required. So, a private car off to an urgent care centre or a hospital, or even an appointment with your local doctor for imaging. Even if it seems minor, rib fractures need proper evaluation, often with imaging, because sometimes what looks simple could have something more serious underneath. So the takeaway, painful, yes. Life-threatening, usually not. Common, yes, but never ignore it. Needs to be seen by a doctor. Because when the chest and breathing are involved, it's always worth taking seriously and getting it checked out.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.